you see, Kavita?
Yes, sir. So, but you have to change, like, it's not full screen, though. Um, It's changing, sir. The slide is changing.
Slide is changing.
Yes.
The thing is, if I'm putting it in the
Slideshow, yes.
slideshow, so whether it's moving or not, I don't know. From current slide. So is it moving? The slides are moving?
So can you just, because it's stuck in your slide.
It's not moving. I'm trying
No,
to.
it's not moving.
Not. It's not moving.
No, it's not moving, sir.
Okay. So probably what I'll do is I'll just leave it like this. Is this okay?
Yeah, that's okay, sir.
I'll try
Moreover,
to.
the message is important.
So is this
Yeah,
okay?
sir. This is better.
Yeah.
Yeah, this is better.
Okay. So let me know.
So
Let me
we'll
know
start
when
the
you
session, sir. Yeah,
start.
I'll start with welcoming everyone. Okay. So, good afternoon, everyone. This is Kavita from Ankura Hospital for Women and Children. And today's we bring this special webinar in front of you on frequent cough and cold in children's. So, as a parent, we often worry when our child has repeated colds, cough, and runny nose. So, most of the parents, we always think it is normal if my children is having immunity low and when to consult a doctor. These are the questions frequently comes in our mind, and through this topic, frequent cold and cough in children, we think it is very common, and especially in growing kids and school going kids and the toddlers. So this session help parents understand why children fall sick frequently, what is normal and what needs attention, and how parent can manage prevent repeated infections. Today's session is designed to answer exactly this question is in a very simpler and practical way. So I request all to please join the hands with me to welcome Dr. Srinivas Jakka, consultant in pediatric pulmonology and allergy. Dr. brings with him extensive experience in managing childhood respiratory and allergy related conditions and sleep disorder in kids. He has trained internationally and worked closely with parents to simplify complex medical concerns into practical guidance. And we delighted to have you with us, sir. Welcome to this webinar. And over to you, sir. Please take it forward. Please guide us
Uh,
today.
Thank you, Miss Kavita, uh,
Yes, sir.
for giving me this opportunity to connect with my patients and their parents on a very important and a relevant topic. Okay, so this this I think it's a post-prandial after lunch, so people might be sleepy. So I will try to keep it interesting and also how much time have we got, Kavita?
So we have time.
Okay, so
Your
30 minutes.
presentation and
Minutes
yeah,
is
30
okay.
minutes. Yes, yes.
30 minutes is a reasonable time.
Yes, and we will have a Q&A at the end, sir, so
Yes.
that at once we can have all questions.
Yeah. So we'll have Q&A for 15 minutes at the end so
Yes,
that
sir.
we can wrap up things by 3 o'clock.
Yeah,
Does
sure.
it sound good to you?
Yes, sir. Perfect.
Yes. Right. So actually, frequent colds and coughs are one of the commonest reasons why parents come to see me. It's one of the commonest presentations. So many times the parents say, "Doctor, my child has, frequent colds and coughs. Is it normal? No, or is there anything I need to worry about? Can it be due to, what is the cause of that? Is it infections? Is it allergies? Do you think there is any problem with my child's immunity? No. Can I give certain types of food? Should I avoid certain types of foods? No. When should we see a doctor? What medicines we can use at home? My doctors gives antibiotics every time. Is it okay? So these are all the common questions which parents ask me. So I made a collection of these common questions which I'm faced in my clinic in day-to-day practice and which also bother the parents. And I have made a very simple presentation so that I don't forget anything when I talk to you. Okay. So let us see. before we decide something is abnormal, we need to know what is normal as well. So there are a lot of studies which show that children, particularly those who attend childcare, so this can be a nursery, a daycare, or a school. Okay, so whenever these children attend these childcare facilities, they are exposed to other children as well. Okay, and when they're exposed to other children, they will be exposed to this frequent infections. And studies have shown that it is normal for these children to have 8 or even 10 episodes per year. If you have more than one child going to this childcare facility, the exposure becomes double and the numbers increase. So, what is the cause of this colds and coughs? If you look at a broad classification, these frequent colds and coughs can be because of infections or it can be because of allergies. So let's see, take one at a time. So if you look at infections, the colds and coughs are usually caused by viral infections. So what are this? Which viruses can cause these colds and coughs? There are a lot of viruses. The common ones are your rhinovirus, your adenovirus, influenza, parainfluenza, and recently our COVID infections. So there are several hundreds of viruses that can cause colds and coughs. Among that, there are 8 to 10 common viruses as well. So, what symptoms do these children have with these viral infections? So, they can have a runny nose, and after that, they can have their nose can get blocked if the secretions are thick, and typically they may have fever. The fever may last for a few days to up to a week or so, and the severity of fever can be mild, or sometimes even with viral infection they may have a temperature of 103, 104. Sometimes this fever may be associated with chills, basically, and rigors, which means that the baby will be shivering during this fever. And there may be history of sick contact. So there may be sick contact can be at home in the form of other siblings or the parents or grandparents, or more likely the sick contact can be at school from the classmates. And apart from runny nose and blocked nose, they can have mouth breathing, they can have snoring, the sleep can be disturbed. If the infection spreads to other parts of the body, the simple cold and cough can cause swelling of your tonsils and adenoids. They can have ear infections. If the infection spreads down, they may have infections of the lungs, which we commonly call pneumonia. Sometimes, rarely, the infection is spread into the bloodstream when the children become very unwell. But these are all rare. Most of the time, they get better in a week or so. And in addition to this cold, cough, fever, they may have, they may feel a bit weak in general. They may be easily tired, and sometimes they may have body pains as well, particularly in infections like influenza, commonly what we call flu. They may have headache, they may have body pains, they may get tired. Then they may have some infections like adenovirus, they may have conjunctivitis, where your eyes become red, sticky with discharge. So these are all the common symptoms due to viral infections. And remember, there is no specific treatment for most of the viral infections. And your antibiotics, which are actually antibacterial drugs, they have no role in viral infections. So the commonest cause of colds and coughs in children are viral infections. If there is associated fever, it's an infection, not an allergy. And usually there is a sick contact from where the child contacts the fever. And most of these viral infections are mild and self-limiting. So that is the first cause, which is the infections. Let's look at the other big category, which is allergies. So what is allergy? Allergy is where your body or your immune system recognizes a harmless substance as harmful and reacts to that. So basically, in allergy, it's not that your immune system is weak, it is just that your immune system is overactive and it recognizes something harmless as harmful, and then the immune system reacts. There are a lot of chemicals produced, and these chemicals cause the symptoms. So allergies can cause cold and allergies can cause cough as well. So if you look at allergic colds, we medically call as allergic rhinitis. Sometimes if the allergy involves the eyes, you call it allergic conjunctivitis. Or sometimes there may be involvement of the sinuses also, then you call it allergic rhinosinusitis. Okay, so again, allergy symptoms can be in the form of a runny nose. The nose keeps on running. The nose can get blocked, and because of the blocked nose, there can be mouth breathing and snoring. So these top four symptoms of runny nose, blocked nose, mouth breathing, and snoring, they can be caused by infections as well as allergies. But what is more specific for allergies is the last two symptoms, which are sneezing and itching. So sneezing, usually there can be sneezing, especially when they wake up in the morning. There can be, this child can sneeze from few times to up to 25 to 30 times, and sometimes they may just go on sneezing for 5 minutes or so, 10 minutes. Then itching is very important. The child may be having itchy eyes, so they'll be continuously rubbing their eyes. They may be having itchy nose where they keep rubbing the nose. Sometimes there may be itching of the palate or ears as well. So these are all itching symptoms. So these symptoms like sneezing and itching, they are caused by the release of medicines called antihistamine. They are caused by the release of chemicals called histamine and other chemicals. And therefore, medicines called antihistamines are useful in this allergic rhinitis or allergic cold. So, summarizing, allergic cold is called allergic rhinitis. It is caused by inhaled allergens like house dust mites, pollen, moles, cockroaches, etc., and animal pets. And the symptoms that are diagnostic of allergic rhinitis are sneezing and itching. And of course, they can also have runny nose, blocked nose, mouth breathing, and snoring as well. So these are all the symptoms of allergic cold or allergic rhinitis. Now, if you look at the other allergic symptom, which is allergic cough is also called asthma. And the typical symptoms are cough, breathlessness, and wheeze. The cough, particularly in allergic cough or asthma, is worse at night time. So you see that the child starts coughing an hour or 2 hours after going to bed, particularly around midnight time. There is also cough which is worse on waking up in the morning. The cough may wake up the child from sleep several times at night time. There may be breathlessness. And the way we diagnose or identify breathlessness is by fast breathing or heavy breathing. If possible, I'll show you the videos of how to recognize breathlessness. So fast breathing, parents can recognize by actually knowing what is the normal breathing rate for the child. For example, a newborn breathing rate may be normal up to 60 breaths per minute. At 1 year, maybe 50, up to 5 years, maybe 40, and above 530. Adults will typically breathe around 20, 18 to 20 per minute. So apart from fast breathing, then there is a breathlessness where you see there is indrawing of the chest, the stomach goes up and down. So all of this is breathlessness. Then there can be wheezing. Wheezing is caused when the airways become narrow or tight. So airways are tubes that carry air to your lungs. What happens in asthma is the airways become tight and the lining is swollen, and because of that there is a difficulty in breathing in and breathing out air. and the air passing through this narrow airways causes a fine musical sound that is called wheeze. Okay, so the typical symptoms of asthma are cough, breathlessness, and wheeze. And we also said that breathlessness can be diagnosed by fast breathing and heavy breathing. And wheeze can be identified like a fine musical sound, like a whistling sound. Then what are the typical triggers for asthma? The common triggers here again are viral infections. Then in addition to viral infections, the triggers can be exercise. When the child is running or climbing stairs, the child may start panting, become breathless, or start coughing. Then you have your uh, uh, environmental factors like cold air, weather changes, any dust, irritants, or strong odors and perfumes in the environment. Then you can have inhaled allergens, the same allergens that can cause allergic rhinitis, like house dust mites, pollen, molds, cockroaches, pets. They can trigger your asthma as well. And of course, sometimes cold drinks, ice creams, and stuff, other stuff can cause asthma. So the typical triggers for asthma are viral infections. Then you have your exercise and activities that simulate or resemble exercise, like laughing, crying, shouting, singing, etc., where you take a lot of breath in and out, they can trigger your asthma. Then you have your environmental factors like cold air, weather changes, cool drinks, ice creams, etc., and inhaled allergens. So all are triggers. And if you see that the symptoms are relieved by the typical drugs used in asthma, like salbutamol or inhaled steroids, that will confirm the diagnosis. So this is the all allergic cough. Then now the parents might say, we can't take your dog, we can't take the child to the doctor every time. The child has a cold and a cough. What can we do for our child at home? So parents don't need to take your child to the doctor every time. When this in the initial stages and when the symptoms are mild, the parents can treat the child at home using home remedies. And one of them includes paracetamol. So paracetamol will be useful in colds and coughs caused due to viral infections, where the child will be having body pains and fever. So drugs like paracetamol, ibuprofen, they're antipyretics and analgesics as well. Antipyretics meaning they can help to bring down the temperature. Analgesics meaning they can reduce the body pains. So drugs like paracetamol for milder symptoms like mild fever and body pains, and drugs like ibuprofen for higher fevers and more severe body pains can be used. During these colds and coughs, particularly due to viral infections, it is better to keep the child rest at home. There are two reasons for that. One, it will because when your child has this viral infections, especially the initial stages, they're usually tired, they don't have much energy levels, so they're not going to attain much by going to school anyway, and maybe giving some rest will help them recover quickly. And not sending them to school during these viral infections will also prevent spread of these infections to other children. Then, of course, fluids are very important for two reasons. One, when your child has these infections, their appetite is low, they're not very keen to take solids. So, giving small sips of fluids regularly will keep them hydrated and prevent dehydrations. The other, and many times, taking a lot of fluids also can help to loosen the mucus and ease the symptoms. Honey can be given at home in children above 1 year of age. This honey will actually soothe the airways and it will help to reduce the irritant cough. Other things like other medicines like or other Methods like steam inhalation can help to reduce the congestion in the nose and sinuses. But when parents are using steam inhalation, it's important to make sure that it is done in a safe way and the child is not exposed to this hot boiling water that can cause burns to the skin. So before the parents go to the doctor, they can try home remedies like keeping the child at home, giving the child rest, plenty of fluids, paracetamol for fever and pains, and honey to soothe them. Right. So then comes the important question: when do we take our child to see a doctor? So there are three reasons when you have to take a child to a doctor: either prolonged symptoms, troublesome symptoms, or a sick child. So if we look at the first aspect, we already discussed that most of the symptoms of cold and cough, they get better in a week or so. If you notice that the symptoms are lasting more than a week, then probably it's time for you to see your doctor. Next, if the symptoms are troublesome, you can see your doctor. So when can we know that our symptoms are troublesome? So troublesome symptoms are those which affect the child's sleep, breathing, and activity. So not only colds and coughs, any disease which affects children, if you want to know the severity, so any disease that affects the child's sleep and activity is probably more severe. Similarly, when the child is having cold and cough, they're waking up multiple times at night time. Their nose is blocked continuously or constantly. They're unable to breathe through the nose. They're waking up several times at night due to cough, or the child is having breathlessness and wheeze. The child is getting very tired, not very active, not able to play. Then you should probably think that your child has troublesome symptoms. Third is a sick child. So, how do the parents know that the child is sick? There are few symptoms where the parents can suspect a sick child. Firstly, the conscious level. Children can get a bit dull during episodes of fever, and then when the fever settles down, they become very active. But on the other hand, if the child is dull throughout the day, not active, not interested in play, child has to be really sick for not to be able to play, not interacting well with the friends or siblings. Child wants to lie down on the bed all the time. You're probably looking at a sick child. Then, apart from the consciousness, if you see the child is breathing. As we discussed earlier, if the child has any fast breathing or heavy breathing, or the oxygen levels are low, or you notice any change in the color of the child, they probably shows that the child has a breathing problem and you need to see a doctor. The third aspect is intake and output. So if you see that the child is so sick that they can't even take liquids, they're getting dehydrated, then you have to see a doctor. You would know that when your child is dehydrated by monitoring the urine output. A normal healthy child should at least have passed urine 4 to 5 times in a day. If the urine output is less than that, again, that probably means that the child is dehydrated. So the symptoms of a sick child are change in consciousness level and activity, find features of breathlessness, poor intake, and signs of dehydration. So you have to see a doctor broadly when the symptoms are prolonged more than a week or so. The symptoms are troublesome, affecting the sleep and activity of the child, or the child shows any red flag signs of being a sick child. So you have to see your doctor. Right. So next comes the role of medications. We already discussed about paracetamol and other medications, when we should use them. Then comes the very interesting and controversial subject of cold and cough syrups. The cold and cough syrups it's like a huge market, $1 million market. There is a lot of pressure of parents to use them and pressure on doctors to prescribe them. Many of these medicines are actually not available in other countries, which are available in our country. And many of our doctors and parents tend to overuse these cold and cough syrups. Having said that, it's not that they're completely without any role or any use. We can use them selectively. What do we mean when we say selective use? First, to see, does a child really need them? So child, as we mentioned earlier, needs treatment for cold and cough only if it is troublesome. It's affecting their sleep, breathing, or activity. So if these are there, then you go and check with your doctor, and your doctor will prescribe cold and cough syrups as needed. Many times these cold and cough syrups available over the counter or OTC drugs. They are a combination of medicines, some of which are counteractive to each other. Sometimes they cause unpleasant symptoms like drowsiness, sedation, etc. So, if your doctor feels that your cold and cough is affecting your child's sleep or breathing, then they can look at the safest possible medicine that's licensed for this child's age and prescribe this medicine to you for a limited period of time. So, in summary, cold and cough syrup should be used only when the symptoms are troublesome and on the prescription of a doctor and for a limited period of time. There are also some topical nasal drops which you can give if your child's nose is blocked, if your child is having difficulty breathing through your nose. Then, if your child has allergic rhinitis, of course, antihistamines can be given to relieve the symptoms. Sometimes, if your airway is blocked due to swellings in the nose or the adenoids, then your doctor might prescribe a steroid nasal spray or a drug called montelukast to reduce the swellings and help in the easy breathing. Again, montelukast is a drug which is often misused. It is a drug not to be used for common cold or infectious cold or cough. It is to be used only in allergic rhinitis and asthma as per the advice of a doctor, because montelukast is known to cause psychological and psychiatric symptoms and sleep disturbances. But having said that, where needed, upon the advice of doctor, you can use it. Then comes the nebulization. When do we give nebulization in colds and coughs? For infectious or common cold and cough, nebulizers do not have any role, particularly the medicines used in nebulizations. Of course, if the child has lot congested, the parents can try giving saline, either normal saline or 3% saline to reduce the congestion. But typically, the drugs used in nebulizer are either bronchodilators or steroids. And these medicines can be given only when the cause of the symptoms is allergic cough or asthma. There is another group of children where they become wheezing with coughs and colds, and they are useful in these children as well. So nebulization is useful only in a select group of patients where the airways have become tight as a result of viral infections or as a result of asthma. And it's not needed for all cases of cold and cough. Then comes the favorite medicine, which is antibiotics. As we told you, the common causes of colds and coughs are either viral infections or allergies, and antibiotics have no role in either of them. antibiotics are antibacterial. Now parents coming and saying, oh, my child had cold and cough for 5 days. We started antibiotics on the first day itself, but the child's cold and cough didn't get better. Of course, it wouldn't, because antibiotics are antibacterial, and the common cause of cold and cough are either viral infections or allergies in which antibiotics have no role. Having said that, is there absolutely no role? Of course, antibiotics can be used when there are complications of this colds and coughs. For example, if the child has any bacterial tonsillitis or acute otitis media or infections in the lung, which we call pneumonia, if these are there as a complication of colds and coughs, you can use antibiotics under the guidance of your doctor. Many times, we the the parents and doctors are in the pressure to use this antibiotics. So my humble request to all the parents is, think twice before you use antibiotics in children, especially for colds and coughs. The reason I'm requesting you so much is because antibiotic resistance is a big problem in our country. This is happening because of an indiscriminate use of antibiotics by parents and doctors alike. So, as a result, in the future, we will be having fewer and fewer antibiotics available to treat serious infections in your children. So, always use antibiotics in caution. So, summarizing the role of medications, we can use paracetamol or ibuprofen for fever and pain. Antihistamines or anti-allergic medicines where allergy is the cause of infections. Cold and cough syrups should be used under the guidance of a doctor for a limited period of time. Nebulization can be used in a selected group of patients where there is wheezing or tightening of the airways due to either viral infections or due to asthma. And antibiotics can be used only when the bacteria are supposed to be the cause of symptoms. So coming to the last slide, how can we prevent this? And this is what you would be most interested to know as parent. The first and most important are hygienic measures. I mean, because of COVID infection, we are all aware of what are the hygienic measures to prevent the spread of respiratory infections. I mean, these can include coughing into a tissue or a kerchief, cleaning your hands, keeping, wearing a mask when you're unwell, staying away from work or school when you're unwell, hand hygiene, staying away from sick people. These are all the hygienic measures which you can use to prevent the spread of infection from one person to another. Staying at home when you're unwell will not only help in early recovery of yourself, but also prevent spread of infection to your colleagues and friends. Vaccination is very important. Make sure that your child gets their vaccines regularly and you don't omit the vaccines. And some of the particular vaccines that will help in prevention of colds and coughs are given right from birth. It includes your BCG given at birth to prevent tuberculosis. Then you have your DPT vaccine, you have your H influenza B or Hib vaccine, you have your pneumococcal vaccines. Some of these vaccines might seem expensive, but if your child becomes unwell and requires hospital admission, the cost is very small compared to that expense. And flu vaccine. So flu vaccine is recommended for children under 5 years of age after yearly after 5 years of age. After 5 years of age, you can give flu vaccine if your child has underlying problems like like your child has heart or lung problems, etc., and you don't want to take any risk of influenza infection. But always remember, flu vaccine prevents against influenza virus only, which is one of the several viruses that cause cold and cough. But the reason we give flu vaccine is because among the viruses that cause cold and cough, influenza is the one which actually can cause more serious illness or more severe symptoms that require hospitalization. And nutrition is very important, and we see that in children who are malnourished or not getting enough nutrients, they're more prone to frequent infections. And if and of course, if your child has any allergic cold and cough, your doctor will give you preventers in the form of inhalers that will prevent the triggers of these symptoms. So the preventive measures summarizing, they include hygienic measures, the ones which we did during the COVID pandemic, staying at home when you're unwell, making sure that you and your child get vaccinated, making sure that the nutrient needs are taken care of. Thank you very much. So we're open to any questions.
Thank you. Thank you so much, sir. Thank you for explaining this so simple and clearly. So I request all the parents to please, if you have any query, you can ask the doctor directly. And I must say, doctor, many parents like us, they can relate to the points which you explained today in this session.
Yeah, you are a mother yourself, Kavita. You can start by asking any question you might have.
So now my child is very fine. He is, and he frequently got this cold and cough.
Hmm.
So and I know, sir, that he's going to school. So most of the infection he's getting from the school from the other kids.
Hmm.
So any prevention measures you can, like you already told us, but
Yeah.
anything especially for the toddlers.
So toddlers are a challenging age group. You can't expect them to wear a mask all the time. Then just simple. When you are when you're joining a child in your childcare facility, even before, make sure that they are going to a place where there are not too many children, where the rooms are well ventilated. That's the first thing. And when your child comes from school, make sure that they clean their hands, and in older children, other hygienic measures we can explain as well. That's another thing. Having said that, one good thing is that you see these frequent infections in the first 1 to 2 years of women attending childcare. After that, as they get exposed to these infections more and more, they get immune to these common infections. And after 2 years or 3 years of starting childcare, they get immune to the common infections, and you see that the frequency and the severity of these infections comes down.
Okay, sir. So any more questions we have today?
People can put it in the chat box, they can type, or
You
you
can
can.
Okay.
directly ask.
Hi, sir. Hi, sir. Good afternoon.
Good afternoon.
Sir,
Who is
my
this,
son
Swati?
usually,
Swati ji?
yes, sir. Yes.
Please.
So my son usually has the habit of mouth breathing. So how do I teach him? Like when he goes into deep sleep and he has the habit of like he snores,
Mm,
actually.
mm. So it's not something you teach him, because it's not that he's doing it. He's
Yes.
voluntarily. This mouth breathing happens because there is a blockade either in your nose or at the adenoid level.
Okay.
So if there's a blockade at your nose or adenoid level, the child has to bypass that.
Okay.
Okay, the child has to bypass that, and that's the reason why the children have mouth breathing. Okay, so we
Okay.
have to assess whether there is any obstruction. Kavita ji, can you see this picture which I'm trying to bring up?
So, no, sir, we cannot see any images
It says
on
your
screen.
screen
This is the
sharing is
glass.
resume share.
Yeah, sir.
Okay, so can you see this? The adenoid picture which I'm bringing up? No?
No, I'm not able to see.
Okay, okay. Anyway, basically, stop share. When the Can you see it now?
Yeah, correct. Now I can see.
Okay. So Swati ji, can you see this?
Yes.
So when you breathe air, it goes through your nose, and through this airway, it goes into your lungs.
Okay.
Okay, so if there is a blockade in your nose somewhere here, or
Yeah.
adenoids here, they're enlarged. These adenoids, they block your airway here.
Okay.
So what happens when this airway is blocked? The child tends to bypass that
Okay.
by breathing through their mouth. Okay, so if you want to prevent mouth breathing, you should get your child assessed where the blockade is, and then treat that blockade, and then the mouth breathing most likely will automatically come down. And the second
Okay.
symptom is snoring. If your airway is narrowed and there is a flow of air through this narrow airway, that causes a lot of turbulence to the flow, and that manifests as snoring.
Okay.
And
Not actually snoring, like it. There's a kind of sound comes when he breathes.
So I
Yeah.
suggest that the best way to find out the cause is actually to record the breathing of your child,
Okay.
what sort of noise it's coming, and you can also see that child is struggling or anything at that time.
So, like it is not like entire night. It is like couple of minutes, sir.
Hmm.
Yeah.
Hmm. So yeah, so basically there are two ways to know the problem severity. One is what you see as a parent, and second is objective assessment. So what you see
Okay.
as a parent can be the duration of snoring and mouth breathing. Is it throughout the day or sorry, throughout the night or only for a brief period? Number one. Is it
Yeah.
throughout the year or only during colds? That's number two.
Now,
And
it is only like now,
and
like he's having a like cough, sir, but not the entire day.
yeah, yeah. So,
Like frequent coughs
yeah.
since like 1 week. Yeah.
So I can't give you a prescriptive advice, but I'm giving you a general idea, Swatiji,
Yeah.
as a in the as a meeting sort of thing. So basically, the things to look for are so it's there throughout the year or only during colds and coughs. It's there only throughout the night or only for a brief period. And how severe the obstruction is, you would know. In severe obstruction, you would see that the child's neck is extended. There is the child is frothing through the mouth, extended. The child's sleep is restless. Child wakes
Okay.
up at night time. There is signs of obstructive sleep apnea where the snoring becomes worse and suddenly there is a brief pause in breathing. The child
Okay.
wakes up in the morning, the child is either drowsy or on the other hand, if the child doesn't have enough sleep, they can be hyperactive during the daytime as well. There can be problems with concentration. So these are all the things which you can see as a parent. And when you come to see me with this problem as a doctor, I can objectively assess by two ways. One is the X-ray, which is of course not 100%. Then the other way is what we call a sleep study, where you actually assess his breathing, oxygen levels, the effort of breathing, etc. during sleep, and then
Hmm.
take it from there.
No, no, it's like all of the symptoms, it's not there, sir. So it's basically like since 1 week he's been coughing. So
Yeah,
not that frequent. It's like in a day, like 2 to 3 times.
yeah.
So
So
it's
let's
happening.
take
Yeah.
this overall things into consideration.
Okay.
The symptoms are mild, intermittent, you don't need to do anything. If the symptoms are severe and persistent, then you have to see a doctor.
Okay, okay, sure. And like, sir, one more thing I've added to his daily routine because since he's a school going kid and he's in class one, so we cannot like tell the other parents to maintain hygiene. It's like I am teaching my child. So whenever he comes back from school, I have made a habit to like make him gargle. So like, is it okay for him to gargle every day?
Gargling is not a harmful thing. I mean, if your child can do it, you can do that, no problems. As long
Okay, so
as
there
you're
is
not
no
using
harm
anything.
like
No, see, if your child can gargle, I don't know what you're using for gargling. The
I'm like putting salt and a bit of
Yeah,
turmeric in the
yeah.
like
So,
lukewarm water.
yeah. So if a child can gargle safely without aspirating it, that's fine. Aspiration is where the fluid goes into the lungs, the wrong route. Okay, so
Okay.
if a child can gargle without aspirating, then there is not a problem.
Okay. Okay, sir. So no harm to the teeth and all, na? Right, sir? Gargling daily.
Gargling should not cause, if you're using only salt and hot water, it should not cause any harm to your teeth.
Okay. Okay, sir. Okay. Thank you so much, sir.
Thank you. And any other questions from other participants?
We got one question. Are nebulizers safe for children?
Sorry, whose question is this?
I think some of from our team members asked that
Oh,
are
okay, okay.
nebulizers safe
Yeah,
for
okay.
children?
Yeah, so of course, see, we need to see first why the child needs a nebulizer. So if a child has wheezing symptoms or breathlessness, which tells us that the airways have become tight, then you need to see what is the best way of giving medicine to these children. So in these wheezing children or breathless children, you can give medicine through inhalers, nebulizers, syrups or tablets. You have three. So a nebulizer is 10 times the dose of an inhaler, and a syrup or tablet is 10 times the dose of a nebulizer. So syrups and tablets have the highest dose and therefore the greatest risk of side effects. They act very slow, so they're least preferred. And if you compare inhalers and nebulizers, inhalers are the best way of delivery of the medicines. So the medicine is the same, the delivery device is different. So inhalers are the best because they have the lowest dose of the three and hence the least risk of side effects. You can give them in 1 minute very easily, especially at night time. You can give them without waking up the child. You can carry them easily from one place to another, especially when you're traveling and they don't need a power supply. So these are all the advantages of inhalers. Unfortunately, inhalers carry stigma in our society, and many parents are reluctant to use them. But they are the best means of delivery if needed. Of course, nebulizers do have a role. If a child is very sick and breathless and they can't take inhalers, then the nebulizers can be given. Particularly, we give them in children admitted to the hospitals. So at home, inhalers are the best, and nebulizers do have a role when the child is really unwell.
Okay, thank you, sir. Thank you so much. Do we have any more questions?
Okay, so if there are no other questions, I
I
would like
think
to
yes, sir.
thank.
We can close the session.
Yeah.
So
Okay.
thank you so much, sir. Thank you for your time, and thank you for this insightful and reassuring session. And I'm sure parents now feel more confident about handling frequent cold and cough. Even me as well. So thank you so much, and thank you so much all the participants who joined us today for this webinar. And I request you to please follow Ankura Hospital so that you get more awareness like this. And we keep on coming with this kind of webinars. And thank you so much. Stay healthy and happy.
Thanks to all the parents and Kavitaji.
Thank you, sir. Thank you so much.